All right, today we're diving into a pretty radical idea, one that comes out of Japan and really challenges everything we think we know about cancer detection and treatment. Seriously, this could change how you view a diagnosis forever. For decades, we've all been told the same thing, right? Find cancer early, get it out, be aggressive. But what if some of the things we're finding aren't actually the enemy we're making them out to be? What if the war on cancer sometimes has us fighting battles that we don't even need to win? So this is where this Japanese concept called gamadoki comes into play. It literally translates to something like mock cancer or cancer-like. The whole idea is that you can have a tumor that, yeah, under a microscope ticks all the boxes for cancer, but in real life, it was never going to grow, spread, or hurt you, ever. And look, this isn't just some theory from a textbook. We're talking about experienced surgeons, like Dr. Tetsuya Isero, who's been in the operating room for years, and he started to notice something odd. He saw that cancers didn't really exist on a smooth spectrum. It was more like they were either one thing or a totally different thing. They followed one of two very distinct paths. And that observation basically created this powerful new way of seeing it all. The two paths. On one side, you've got the Gamodogi path. Think of it like a turtle. It's slow, it minds its own business, and it might just sit there harmlessly for your entire life. On the other side, you've got the aggressive path. That's the cheetah. It's fast, it's dangerous, and you have to act now. So let's stick with that turtle for a minute and explore the Gamodoki path. Okay, so what does this mean in the real world? Like, which cancers are we actually talking about here? Well, the data and a lot of the new medical guidelines are starting to point to a few specific and really common types. First up, low-risk prostate cancer. And this one is a really big deal. We're talking about official urology guidelines from just 2023 that say, for a lot of guys, the best option isn't surgery or radiation, it's active surveillance, which is just a fancy way of saying we'll keep an eye on it with simple blood tests. Next on the list is a specific kind of thyroid cancer, papillary thyroid cancer. And get this, when these tumors are found and they're tiny, like under a centimeter, the numbers are just stunning. Over 90% of them just sit there. They don't grow, they don't spread. So now, just watching them with imaging is a totally standard option. And this way of thinking, it's starting to catch on. For small kidney cancers, a lot of international guidelines are saying, hey, maybe we just watch these two. And it brings up some really tough questions about breast cancer, where studies are suggesting a pretty high rate of what they call overdiagnosis, basically finding things on a mammogram that if we'd never looked might not have ever caused a problem. So this begs a pretty huge question, right? If these things don't really act like the scary, life-threatening disease we call cancer, then why on earth are we even calling them cancer to begin with? Well, the theory is that the problem might be with the rule book itself. You see, when a pathologist looks at your cells under a microscope, they have a checklist of things that define cancer. The idea behind Gamodoki is that maybe, just maybe, that checklist is a little too sensitive. It's catching cells that look the part, but we're never going to audition for the main role. Right. And this isn't just about what we call things. It has huge, real-world consequences. Because treating these harmless Gamodoki tumors, well, that comes with its own set of very real risks. I mean, let's be real. Surgery is a big deal. It's not a quick fix. You're talking about physical scars, the risk of infection, the money, the time off work, and sometimes losing the function of an organ forever. And you have to ask yourself, was all of that worth it for something that was never going to be a threat?
This really gets to the heart of the dilemma for doctors. Dr. Osero said it perfectly. He'd finish a surgery, everything goes by the book, it's a technical success, but he'd walk away thinking to himself, was this truly a happy surgery? The operation worked, but did it actually make the patient's life better in the long run? That is a heavy question.
Okay, now we need to pump the brakes here for a second, because this is super important. This whole Gamodoki idea does not apply to all cancers. Not even close. In fact, it makes it even more urgent that we talk about the other path, the cheetah, the ones that race. These are the cancers that are absolutely terrifying, and for good reason. Pancreatic cancer, so often found way too late, small cell lung cancer, which is known for just its explosive growth, and malignant melanoma, a skin cancer that can spread through your body like wildfire if you don't catch it. So for these guys, there's no question, no debate. The old mantra, find it early, treat it hard, that absolutely saves lives. The whole trick, the real challenge for the future of medicine, is getting better at telling the difference. It's about knowing if you're dealing with a turtle or a cheetah right from day one. Okay, I know, that's a ton of information. So, what do you do with all of it? How can you actually use this to be a smarter, more empowered patient if, heaven forbid, you or someone you love gets a diagnosis?
It really boils down to four key things. One, find a doctor you can actually talk to, someone who trusts. Two, for any big diagnoses, always get a second opinion. It's not rude, it's smart. Three, and this is important, ask them straight up, does this treatment plan follow the most current guidelines? Because sometimes they don't. And four, try to understand the nature of your specific diagnosis, not just that scary, one-size-fits-all word, cancer.
When you do these things, you're changing the game. You're no longer just a passenger along for a scary ride. You become an active part of the team, making decisions about your own health. You're basically swapping out fear for understanding. And all of this leaves us with one last, kind of a heavy question to think about. When it comes to cancer, is the ultimate goal to be cancer-free at any and all costs? Or is the goal to be healthy, to live a long, full life? The whole idea of Gamadoki really makes you wonder if those two things are always the same. Thanks for digging into this with us.